Thank you very much, Ms. Williams, Acting DG of the GCIS. The Deputy Minister, the DG, the senior management of the department and members of the media. My main task today is to provide information on the preparations for the move to stage 4 of the lockdown and the partial return to the workplace tomorrow. This is the focus of today. However, the Deputy Minister will also provide additional information regarding the department's other services. Government has said that easing of the lockdown will be carefully phased, or a carefully phased process based on the risk assessment and the necessary levels of preparation. Therefore, in returning to work, it cannot be business as usual. With this in mind, as Minister of Employment and Labour, I issued a direction in terms of Regulation 10, subsection 8 of the regulations issued by the Minister of Cooperative Governance and Traditional Affairs in terms of Section 27, subsection 2 of the Disaster Management Act 2002. That's Act number 57 of 2002. The direction sets out the measures that employers are required to take to prevent the transmission of COVID-19 in workplaces. And these, we must emphasize, are minimum measures. Employers can be able to go beyond that. The department is working closely with the Department of Health in creating an environment to support the employers in combating the disease. It should also be flagged that the Inspectorate conducts inspections at all workplaces, including healthcare facilities, in terms of the regulations for hazardous biological agents to ensure safe and hygienic conditions. The direction seeks to ensure that measures taken by the employers under the Occupational Health and Safety Act are consistent with the overall national strategies and policies to minimize the spread of COVID-19. The direction reflects all that we have learned about the virus and how to combat it over the period of the lockdown and from international best practice. The direction contains the basic measures that employers, by basic measures we mean the minimum, that employers must take to prevent the transmission of the coronavirus in the workplace. Businesses that are reopening must put these measures in place before restarting the work. I want to emphasize this, that the businesses that are reopening must put the measures in place before restarting the work. They know themselves in terms of the regulations, in terms of the guidelines which were issued by the Minister of COCTA and Minister of DTIC. They are very clear which are those sectors. I think it's in Annexure E. Annexure E, it's very clear which are those sectors in terms of that gazette. A risk assessment or risk assessment review must be undertaken to adapt the provisions of the direction to the specific requirements of the individual workplaces. The direction in no way reduces the existing obligations on employers in terms of the Occupational Health and Safety Act of 1993. The direction is based on infection transmission prevention and specific occupational hygiene practices that focus on the need for employers to implement measures to mitigate or eliminate the transmission of the virus in the workplace. Employers must take measures to protect the health and safety of everyone in their workplace. This includes employees of contractors, self-employed persons, and volunteers. The process starts with a risk assessment in the workplace and a clear plan to implement the measures contained in the direction. Every employer must do the following: notify workers of the contents of the direction and how it will be implemented. They must inform employees that if they have COVID-19 symptoms, they must not be at work and grant paid sick leave or apply for COVID-19 TERS benefits. The employer must appoint a manager from within the existing structure to address the concerns of the employees and workplace representatives. This must take measures, or they must take measures, to minimize contact between the workers and the public to prevent the transmission. They must minimize the number of the workers in the workplace at any time through shift or working arrangements to achieve social distancing. The employer must provide employees with information concerning COVID-19 and how to prevent its transmission. They must report any diagnosis of COVID-19 at work to the Department of Health and the Department of Employment and Labor, investigate the cause, and take appropriate measures. It is a contravention not to do so as an employer. They must support any contact tracing measures initiated by the Department of Health. With regard to social distancing, workplaces must be arranged to ensure a minimum of 1.5 meters between workers. If this is not practicable, physical barriers must be erected and workers must be supplied free of charge with the appropriate personal protective equipment, the PPEs. Social distancing must be implemented in all common areas in and around the workplace to prevent crowding, including working spaces, canteens, meeting rooms, etc. In relation to screening, employers must screen workers for symptoms of COVID-19 at the time that they report for work, namely fever, cough, sore throat, redness of eyes or shortness of breath or difficulty in breathing, body aches, loss of smell or loss of taste, nausea, vomiting, diarrhea, fatigue, and weakness or tiredness. Workers should immediately inform the employer if they experience any symptoms whilst at work. Not doing so is a contravention of the Occupational Health and Safety Act by the worker. More importantly, the worker put themselves and their own co-workers at risk. So you can see, we're talking about responsibilities and obligations from both sides of the employer and the employee. Workers with symptoms must be placed in isolation and arrangements made for their safety or for their safe transport for a medical examination or for self-isolation. Shops and other workplaces to which the public have access must screen all persons entering the workplace for symptoms. Employees who recover from COVID-19 may return to work after the medical evaluation and subject to ongoing monitoring in line with the instructions of the department. It can't be CODIV. It's COVID. It's COVID. It can't. COVID-19. So in line with the instructions of the Department of Health. In relation to sanitizers and disinfectants, employers must do the following. Provide sufficient quantities of hand sanitizer with at least 70% alcohol content. Ensure that work surfaces, equipment, and common areas such as toilets, door handles, and shared equipment are regularly cleaned and disinfected, and they also provide adequate facilities for hand washing with soap and clean water and sufficient paper towels. On masks, workers must wear masks at work. Employers must require members of the public entering the workplace to wear masks. Employers must provide each employee free of charge with at least 2 cloth masks to wear whilst at work or commuting. They must be suitable for washing and drying masks. Ultimately, the employer remains responsible for maintenance and upkeep of the PPEs. Where risk assessment indicates workers must be provided with alternative appropriate PPEs, e.g. the N95 or the N97 masks, to provide a greater level of protection. Every workplace must be well ventilated to reduce the viral load. In relation to personal protective equipment, employers must keep to date the recommendations from the agencies, such as the National Institute for Communicable Diseases and the National Institute for Occupational Health, on the appropriate steps to take to prevent transmission in their workplaces and for the provisions of the PPEs. In relation to enforcement, labor inspectors are empowered to promote and monitor and enforce the compliance with the direction. Any employer who does not comply with the direction may be ordered to close business. In addition, as the failure to comply fully with the OHSA, the Occupational Health and Safety Act, it's a criminal offense. Failure to take necessary measures to prevent the transmission of COVID-19 may result in the criminal prosecution. Investigation and enforcement services. Those are the regulations, but I need to update you on the state of readiness and the inspection and enforcement of the regulations. The labor inspectors have carried out some 2,226 inspections during the lockdown. These include public sector premises and 86 health facilities. The rate of compliance by the employers has increased from 50% to 60% over the period of the lockdown. The inspectors inform me that the basic hygiene measures and PPEs are increasingly evident in most of the workplaces. Where this was not the case, on average of 9 prohibition orders were issued per day, leading to the total or partial shutdown. Currently, there are 170 inspectors in the field out of the 200, and I need to mention that this includes highly experienced, qualified inspectors used to working with the hazardous material. In 2019 budget, provision was made to employ additional 500 inspectors. The process is now being expedited to meet the demands of the pandemic. The department is looking at using accredited, registered inspection bodies to increase its reach. It would be impossible to inspect every one of the 1.8 million businesses. Therefore, inspectors rely on the support of the individual workers, the unions, and socially responsible employers in providing vital information, which in turn allows the inspectors to focus on the hotspots and to make example of a particular offender or particular offenders. In turn, this leads to great self-regulation and compliance. And I need to make the point that whilst we depend on the goodwill of the responsible employers, workers, and also have a responsibility here. They have to wash or sanitize their hands, to wear the PPEs provided, to keep their workstations clean, and to follow directives in relation to health and safety. This is in everyone's interest, that everyone remains safe and we curb the spread of the coronavirus. We need to also stress the role of the stakeholders in the workplace. The safety reps and the health and safety committees, which have come into their own during the present pandemic. It is vital that we get the buy-in from the workers in the implementation of this direction, and we draw on the expertise that exists on the shop floor. That is why the unions are so important. In addition, at the national level, at NETLEC, we're discussing the framework to allow the union leadership to move around to address disputes in individual workplaces. It's important that we acknowledge the role of the social partners in NETLEC in the development of this direction. We are also mindful that the direction imposes a number of additional burdens upon the employers, and we will monitor this situation very closely. But thus far, we have been cooperating with the employers, with the unions, and the community organizations at NETLEC. The COVID-19 crisis has highlighted a number of gaps in our social provision in relation to the UIF. There are important groups that are not covered: informal sector, non-standard and freelance workers. These issues have been raised by the International Labour Organization, the ILO, in relation to the future of work, where a growing number of persons do not fit into the traditional employer-employee relationship. This matter is firmly on the agenda of the department. At this point, the responsibility remains within the realm of social development and President's undertaking to expand the social security safety net. And thank you. Let me hand over to the Chief Inspector. The Chief Inspector who will address the development of the sector guidelines and the technical aspects of the direction.